Ohio's hospitals report they are at or near capacity right now because of a surge in COVID patients to levels not seen since last winter, as medical professionals overwhelmingly continue to recommend COVID vaccines and masks. Even if makeshift hospitals set up at the start of the pandemic are stood up again, that won't solve the problem. There are not enough doctors, nurses, and other staff to take care of the many patients who are trending younger, sicker, and nearly in all cases, unvaccinated. Statehouse correspondent Jo Ingles reports.
Just a couple of months ago, Shaquilla McCarty was a nurse at a Columbus hospital.
So over the last year and a half, we've seen a lot. We've been through a lot. It's been very taxing on the healthcare community. It started out where we got all the support of the community, and then it turned into kind of a distrust between the healthcare community and the community, our community. It became where we felt more threatened as healthcare workers. And I was tired of feeling like that. We've seen a lot of death, a lot of very sick individuals. We've had to have some very difficult heart-to-heart conversations with family members, and it takes a toll on you mentally after a while.
McCarty says the toll was so great that she quit, and she now works for an insurance company. Other nurses and medical staffers are doing the same, further exacerbating a shortage of medical care professionals.
Everybody at the hospital seems to be dealing with belligerent, aggressive family members of people who don't believe in the reality of COVID. They get upset about restrictions in visitation. They want treatments that are not evidence-based or have evidence that they're ineffective. But, they get frustrated because they hear something, they read something on Facebook, oh, this helps, and then they want it. And that's very frustrating.
Smaller hospitals are also affected. Dr. Gregory works in a hospital in a small town near Columbus. He says doctors and nurses are putting their own health and sometimes their lives on the line daily. He recently saw it firsthand when a medical team was trying to keep a COVID patient alive.
And I saw our nurses, our respiratory therapists working valiantly to resuscitate him. In some cases, their own PPE was falling off because they were so vigorously pumping on his chest and trying to intubate him. In some cases, our respiratory therapists were literally inches from his face, which was spewing secretions. And I knew that they were exposing themselves to the coronavirus. Now, everyone was vaccinated, but we know that these breakthrough infections occur. And they knew that too. But yet they still did their job to try to save this man's life. And I knew that they wouldn't stop until they were told to stop. But this weighs on us because on one hand, we took an oath to help people. But on the other hand, we know that we're potentially jeopardizing our families. We're potentially jeopardizing our own lives. And that's tough.
Medical staff in hospitals are not the only ones feeling strain right now. Dr. Michael Joseph works with a medical group that operates urgent cares in Central Ohio, where many people are going to get COVID tests being requested for employers, traveling, or entry into special events.
The sort of expectation that we are a fast food restaurant of COVID testing, if you will, has definitely affected staff morale.
And he says the front office staff often takes the brunt of it.
I've had people, front desk people in tears that I've had to, help counsel here and try and, regroup. And, I've had to talk to patients who were inappropriate with our staff and, help them calm down as well.
The shortage of healthcare workers right now is real in clinics along with big and small medical facilities.
We have nurses leaving the field, retiring early, finding jobs elsewhere. because the long hours, the 16-hour days, the 20-hour days, extra shifts, the emotional strain that it is putting on them as the numbers continue to dwindle staff-wise is making them want to get out of the medical field. On top of that, as you mentioned, our COVID numbers are now going up. So in June and July, I didn't see any COVID patients. August, September, now the majority of my census in the hospital are COVID patients, and they are younger, anywhere from 30 to 50 is what we're seeing here in Northwest Ohio.
Dr. Alan Rivera says COVID patients are very sick and tend to stay in hospitals longer than the average patient. The pandemic is affecting people with other problems too, those suffering heart attacks and accidents and with other illnesses that cannot get treatment because COVID patients are using valuable resources.
It's impacting all other patients who require care in our ICUs. ICU beds, ECMO beds are full. Just this week alone, I have received approximately 10 to 15 calls from doctors in our community, our state, and the surrounding tri-state area requesting ECMO for their dying patients. These patients are anywhere from the ages of 18 to 60, but actually this time, the majority are in their 20s to 40s, as you outlined, often otherwise healthy. These patients are healthy this time around, and the vast majority are unvaccinated. However, we have no space, and we don't have the additional nurses this time. We have to put them on the waiting list, something we learned to do during our last surge of COVID, when we had to turn multiple patients away because of resources. And too many times than not, these patients die at the other hospital waiting for this critical resource.
And again, doctors and nurses are the ones seeing that happen over and over.
I'm sad to think that we couldn't care for somebody because we just didn't have the room to do it. I think of the pressure that it weighs on that family member, hoping to just be able to, if I just get to this place, maybe they'll have a chance. And they're waiting for days and days and weeks, or not even getting that chance anymore because unfortunately they expire. And that's just not, we're just looking at their names from a bedboard. They are a patient I'm waiting for. But this is somebody's mom or somebody's dad or somebody's brother. And they're a human being too. They're not just a number. They're not just a name.
We've got patients in their 30s, and now we're dealing with, women who are pregnant and they're in their 30s. And it's just a sad situation that we're dealing with. And I think everybody here is emotionally exhausted and just really affected personally, at work and at home. It's hard to come in with the staffing levels that we have, with the shortages of equipment that we have, and play that balancing game that we play every day with beds, with equipment.
A study this spring in the Journal of the American Medical Association suggested a significantly increased suicide rate for nurses, who are the largest component of the healthcare workforce. Those who look out for the mental health of medical workers say it's important to remember the impact of the pandemic on those subjected to the worst parts of it every day.
The nurses are struggling too, the docs are struggling too, the people who clean the rooms at the hospital and the people that are drawing your blood. If you go to the hospital, I know it's hard, but just try to be kind.
Jo Ingles, Statehouse News Bureau.
A report earlier this summer showed a little over a quarter of healthcare workers are unvaccinated, but many medical systems are now requiring COVID vaccines. It's unclear how many unvaccinated medical professionals might quit or have quit rather than get the mandatory COVID shots. But experts say it's likely to have an impact in rural areas where hospitals are already struggling with unvaccinated patients.